Coming up on the program, our healthcare experts discuss the latest in medical news from the previous month, and then they answer your questions.
Support for What's Health Got to Do with It is provided in part by the American Brain Foundation invests in research across the spectrum of the brain, knowing all brain diseases, disorders, and injuries are connected. There can be no cures without research. Learn how you can make a difference today at americanbrainfoundation.org. Rethreaded knows human trafficking destroys lives, but they also know it's not the end of the story. Rethreaded believes in the potential and power of all survivors to reclaim their lives. Visit rethreaded.com to learn more. And Elevate Med. Through mentorship, leadership development, financial literacy, a robust peer network, and tuition-based scholarship support, Elevate Med is dedicated to the next generation of diverse physician leaders as a tangible step towards the eradication of health disparities. More at elevatemed.org.
Hi, I'm Dr. Joe Sirven, a practicing neurologist at Mayo Clinic. This is What's Health Got to Do with It, which looks at where and how healthcare intersects with your life, helping you get the medical answers you want. Coming up, it's our monthly medical roundtable, and we are discussing the biggest health headlines from the past month. May was another whirlwind month in health news with headlines that spark conversation and concern. We're talking about a groundbreaking blood test for Alzheimer's, a shift in how patients are seeing test results before their doctors do, rising cancer rates among young adults, troubling measles upticks. Famous musicians Michael Bolton and Billy Joel have brain conditions, and the fresh salmonella warning to top it all off. Joining us to talk about these topics are doctors Jennifer Cowart. She's a practicing hospitalist in the Jacksonville, Florida area. Dr. Cowart, welcome as always.
Thanks for having me back, Joe.
It's always great to have you here. Dr. Joseph Driscowski, a professor of neurology, a practicing neurologist at Mayo Clinic in Phoenix, Arizona. Dr. Driscowski, always good to have you back.
Always great to be here, Joe. Thanks so much.
You bet. And Chad Nielsen, he is at Nemours. He is head of infection control and prevention there. Chad, always good to have you back.
Thanks, Joe. Always happy to be here.
We're going to start with arguably one of our biggest headlines was that the FDA greenlit the first blood test to help diagnose Alzheimer's disease in the United States. Now, this is a major advance in Alzheimer's detection. For the first time, a simple blood test was cleared by the FDA to help diagnose the disease in people 55 years and older who were showing symptoms. The LumaPulse test looks for proteins linked to Alzheimer's, and while it's not a standalone diagnostic tool, it did show strong accuracy in detecting amyloid plaques, a hallmark of the condition. With Alzheimer's expected to double by 2050, experts hope this simple blood test could make diagnosis easier, cheaper, and more accessible, potentially replacing costly brain scans. The FDA says it must still be used alongside other medical evaluations, and false results, like any blood test, could remain a risk. Dr. Driscowski, we're going to start with you. This new test looks for proteins linked to Alzheimer's, but it doesn't give a yes or no answer. If someone gets this LumaPulse test, what exactly do the results mean, and do you trust them?
Yeah, the results are generally, just as a reminder, Alzheimer's disease represents about 80% of dementia. As you mentioned, it's going to be a big part of healthcare as us boomers, age. So we have a lot riding on it. Do I trust it? Yes. I had my first positive result on one of my patients the other day who also had a comorbid condition, and it was helpful from a standpoint that I was able to incorporate that into the management of the patient and have the family, be advised on what is likely to happen. And as has been mentioned, and I think it's important to re-mention it, is that this is part of a complete diagnostic evaluation at this time. If you look at the Alzheimer's Association back several months ago, they said it was only used for research purposes and in special cases, but now it's really changed that at this point in time, and it is it's part of a general workup that most neurologists are easily able to incorporate in their evaluation of these folks. Having a biomarker, it really gives the families assurance. We're going to learn things as this gets out into a wider spread use, but for the most part, I think it's going to be very, very helpful in for families to really help decide what to do with patients and what to do with their families as far as family planning. Back in the day, when we were young, Joe, we had many conditions that were neurology, and they would say, "Oh, what difference does it make if you diagnose it now or later?" Well, it turns out, as we've had on the show several times, there's now treatment, and those treatments that are used for Alzheimer's depend upon early recognition to provide early treatment to be the most effective they can be. So I think as part of a general evaluation process for the potential for Alzheimer's, it's gonna be a bit of a game changer in my opinion. It's not a standalone test, as you mentioned, but as a part of an evaluation, a comprehensive evaluation, I think it'll be very good.
Do you think that we'll still need to get some of the other tests that were done, the scans, the sometimes you needed spinal fluid? Are
Yeah.
those still going to be kind of still part of this?
I think it will be for the short term for many of us. We'll have to get used to how good this is, and as this, as these tests be reevaluated once it hits the general population, what I would hope that wouldn't happen right away is until we know a little bit more about it, that you just get the Alzheimer's, you get this test, and then say, oh yeah, the patient has Alzheimer's. I don't think it's at that point yet. But someday it may be, but not at this point in time. I hope that answers your question.
It does. And one last question. So this should be only taken if you have signs or symptoms
Yeah,
that suggest that's the case, not if you are completely doing well.
asymptomatic. Yeah, yeah. I don't see any use for it at this point in time. That's I think people may look into that, but right now, as it stands, I don't think that's a good use of this technology. So.
We're going to pivot to another topic. This is one we've also covered quite heavily in the show, and that is looking at both measles update as well as a COVID vaccine update. So let's start with measles, with over 1,000 confirmed cases across the United States, the highest we've seen in nearly 25 years. There are clusters growing from Arkansas to El Paso. Cases are creeping into places like California and New York, even across the border to Mexico. Public health teams are racing against time with contact tracing and vaccinations. And it's a troubling trend as we edge closer to breaking a 25-year-old record. It's also important to note some places have stopped publicly sharing some of these alerts regarding measles, such as Florida. We're not sure why. And so, Chad, I'm going to just point this to you. Where are we in the measles outbreak? And then my other question, what about Florida data or other states that don't want to report?
So, as you pointed to, as of May 23rd, the CDC has confirmed over 1,000 measles cases across the U.S. It's in 30 states so far, including Florida. And we are on pace right now to break our previous high from 2019, which was somewhat over 1,000, but we're already more than 50% there, and it's not quite June. 96% of these cases, the CDC is saying, were either unvaccinated or they reported an unknown vaccination status, so they lump them in with the unvaccinated. And there's unfortunately been 3 deaths, 2 kids and 1 adult, all of whom were confirmed to be unvaccinated. Now, this has touched Florida only recently. We've had 1 case confirmed in 2025, and what we know about that case, they were an unvaccinated high school student in South Florida, Miami-Dade. But we don't know if there's been follow-up cases. I can speak from my own experience. We have tested a variety of different children in the Nemours system for measles, none of which have been positive. But it's a little bit of an unknown right now as to what's going on in Florida and some of these other states as the reporting and the data has dried up.
So, Chad, I'm just going to be very practical. We are very much now in the summer season. People are vacationing like crazy as they take advantage of the weather and school being out. What is the best advice for all of us traveling this summer?
Well, I think first and foremost, the CDC still recommends getting your MMR vaccine if you haven't, or updating it if your or your children are sort of behind the schedule for it. That's the number one way to prevent measles is getting that MMR vaccine and starting that series if you haven't already. If you know that you're going to be traveling and you've been exposed, you should not travel and monitor your symptoms for up to 2 weeks because measles takes a little bit of time to show itself. And then if you know you're traveling to a region that has an outbreak, so some of these areas in Texas or hotspots in New York or elsewhere, you're going to want to make sure you do get that vaccine up to par. And then when you return, monitor yourself for symptoms for 14 to 21 days after. So I think it's just about being prepared on the front end and monitoring your status on the back end. And people should feel confident that they can travel.
Chad, I'm going to pivot to another infectious disease, and this is COVID-19. The FDA has given a bit of new guidance out. It seems to be just coming out left and right when it comes to COVID vaccine or COVID boosters, maybe that's a better way of putting it. Just guide us. Where are we now? What is the recommendation with regards to COVID boosters?
So the FDA and Health and Human Services are adjusting what their recommendations for the COVID booster looks like. So currently, the CDC is recommending everyone 6 months of age and older to receive the COVID-19 booster annually. HHS is now, Health and Human Services is now rolling that recommendation back. So they are now saying that it will be more targeted to elderly individuals, 65 and up, and those only in the strongest risk categories based on comorbid conditions, which are relatively undefined. I think the point here that really stands out is this is very rare. We have not seen Health and Human Services basically usurp the traditional process of how vaccines are recommended to the public. Typically speaking, the FDA authorizes or approves a vaccine to be used, and then they turn that over to the CDC's independent sort of task force that then makes the recommendation of who can get this vaccine. And so this is new. We've not seen this before from HHS, but for them to say it doesn't matter what the CDC thinks at this point, we're going to say that this recommendation is not going to hold anymore. That's unusual. So now at this point, HHS is saying they are not recommending the COVID booster for children, and they're not recommending it to a wider audience of healthy people. So to be determined if this will still be available at your local doctor's office. Typically, a recommendation is a recommendation. It does not necessarily mean that you won't be able to find that vaccine. But I will say we anticipate that because they're no longer recommending it, you could face challenges getting this paid for by insurance if you elect to have it. And in general, pharmaceutical companies might not have incentive now to make it widespread. So the shot, even if you do want it in the fall, may be a little harder to find.
Got it. We're going to pivot to yet another topic. And Dr. Cowart, we're going to point this one at you. We're looking at cancer diagnosis in people under the age of 50 are rising worldwide. There was a global study that was published in the British Medical Journal Oncology that revealed that cancer rates in people under 50 have jumped by almost 80% over the past 3 decades, the most common being breast, tracheal, lung, and stomach cancers. Experts cite lifestyle, environment, and dietary factors along better detection as possible contributors. So, Dr. Cowart, how concerned should we all be about this rise and what appears to be early onset cancers?
Yeah, it's such a great question. And since I'm still on that lower side of 50, I take this very seriously, not just for my patients, but for myself and my family. So looking at the studies that have been published, they went back to the early 90s and compared it to late in the 2010s, so pre-COVID, and they showed that there was this rise in cancers. They said early onset, but they defined early onset as under 50. We used to think of cancer as something that only really impacted folks who were older, and now we're seeing it in folks under 50 at a rising rate. Globally, they do point out that some of this is increased early detection. So we are doing more screening. So we are catching these earlier globally, but we do also believe that we are seeing a rising incidence. So it's twofold, better screening and more cancers happening. Now, in the US, this is also true. So we are seeing a rise in overall cancer diagnoses in the US. Fortunately, in the US, we are continuing to see mortality from cancer going down.
Good.
So even though we're diagnosing more cancers, fewer people are actually dying of the disease when you look at the rate in the population. So this is a good thing in a way. It means that we're finding it. We're able to treat more patients. We have better treatments. We're catching it earlier. And so this is a really good reason to get your screening and get in touch with your doctors. So I want to point out a couple things here. One is some changes to screening that folks may not be aware of. So it used to be that colorectal cancer screening started at 50 and would go up. You would have your cancer screening every year after that. But now they've actually lowered the age. The U.S. Preventative Services Task Force has lowered the age of colorectal cancer screening to 45. So if you're 45 and up and you have no family history of colorectal cancer, we would now be inviting you to screening. And you can have that with the stool testing for fecal occult blood, or you can have a colonoscopy. We know that, unfortunately, colorectal cancer screening is underutilized. So if you're concerned about your risk for cancer, please talk to your doctor about getting your colorectal cancer screening. And then if you're like me and you have a family history of early onset colorectal cancer risk factors, you may be younger than 45 when you have your first colonoscopy. And I can tell you that it's not that bad and it's a great nap. So go get it done. The next thing I will say is breast cancer. So this is one of the more common cancers in the early onset. U.S. Preventative Services Task Force does recommend the mammograms for women starting at the age of 40. And it could be even younger if you have a family history, if you have genetic risk factors, et cetera. So know your family history whenever possible and talk to your doctor. Certainly start getting that evidence-based screening at the age of 40 or earlier. Cervical cancer screening. So cervical cancer screening has changed quite a bit. It used to be an annual pap smear. Now it has changed a little bit, but we do start checking folks for cervical cancer screening risk at the age of 21, going up to 65. And that's one that we have a preventative now. We have the HPV vaccine. And so the CDC is recommending HPV vaccination, and everybody who qualifies, the younger you get it, the better. And that is a vaccine that can help prevent up to 90% of HPV-related cancers. So it's a huge benefit to all of us to get our children this vaccine if they're at that right age, and to continue checking in with your doctor because those cancer screening guidelines have changed for cervical cancer. And for prostate cancer, which has been in the news recently, related to former President Biden's diagnosis. So the American Cancer Society does recommend prostate cancer screening start at the age of 50, unless the person is at very high risk, and then it could be 40 or 45. Depending on the specific risk factors. It's a shared decision between the patient and their healthcare team, what type of screening and how to undergo that. But the big things here is know that there's been some changes in screening.
Right.
Know that the ages may have changed. And if you're worried about it, please talk to your doctor. And then the last thing you brought up, Joe, was the lifestyle issues. And so this was mentioned heavily in the report of why they think that these incidences might be going up. So they really focused on a couple key things that all of us have in our control to some extent. So one, healthy lifestyle. They specifically call out excess consumption of red meat and a high sodium diet. So that's a pretty American diet, right? A lot of red meat, a lot of sodium. But if we can start reducing those things within reason, that can lower our risk of those early onset cancers. Alcohol is another one. We don't talk about alcohol as a carcinogen very often, but it really is. And lowering our alcohol intake can really help reduce, again, those excess risk of early onset cancers. And then avoiding smoking. So whether you're taking your nicotine in whatever form, it can lead to folks wanting to smoke cigarettes. Cigarettes are full of carcinogens. They're really associated heavily with those lung cancers. So if you can never smoke, it's obviously the best. And if you have smoked or you started smoking, get help quitting, because that will start to lower your cancer risk. So get screened, talk to your doctor, try to live the healthiest lifestyle you can. And then if you do get diagnosed, know that treatments are getting generally better, and talk to your healthcare pet team so that we can make a plan.
And to all of our listeners out there, you're listening to What's Health Got to Do with It on WJCT News 89.9. I'm Dr. Joe Sirven, and if you're just joining us, it's our monthly medical roundtable, and we want to hear from you. Tag me on social media at JSirven. Let's continue on with yet another topic. This was a CDC warning regarding salmonella outbreak linked to backyard poultry. Chad, I'm going to turn to you on this one. The CDC has issued a warning after confirming more than 100 cases of salmonella linked to backyard poultry flocks. Many of those infected are kids. While raising chickens and ducks at home has become more popular in recent years, especially with rising egg prices, especially also since the pandemic, health experts are reminding the public that these animals can also carry harmful bacteria, even if they appear clean and healthy. Chad, remind us about what is salmonella and how does it spread from birds to people?
So salmonella is a type of bacteria that can cause GI illness in people, and I think everybody is familiar with that. It is a bacilli, gram-negative bacteria that passes from the feces of people or animals to other people or animals, and it typically spreads from poultry to humans through contaminated food. If the meat or the chicken itself is not cooked to a safe minimum temperature, the bacteria basically survives cooking, and then when you eat it, it can cause illness.
Why are kids especially vulnerable? Why them versus other groups?
Well, there's a few reasons. So first and foremost, as with most infections in kids, they don't have a fully developed immune system, so it makes them less capable of essentially fighting off the bacteria that gets into their little bodies. They're also more prone to develop severe diarrhea, which salmonella does cause. And as most parents know, a lot of fluid loss in kids through vomiting or diarrhea can lead to severe dehydration and hospitalization. And so that's a huge risk for them, especially with salmonella. And then, as most parents know, kids can be basically little moving germ factories, right?
Yes.
Because of their
Yes.
behavioral tendencies. They like to put things in their mouths. They're not always great at washing their hands or practicing good hand hygiene. And so, unfortunately, they end up picking up these bacteria, and it goes right into their mouths,
Yep.
and that's how they get infected.
So give us your best sense of your interpretation of CDC recommendations for staying safe if you happen to be keeping backyard chickens or other poultry.
It's funny you actually asked this. The last time I was on my Air Force drill weekend, we had a member who has a backyard chicken flock, and she said, "Hey, everyone, do we want eggs?" And I'm the public health officer looking at everyone saying, where did those chicken eggs come from, right? But and so it can be actually very enjoyable, and people do it for hobbies and things like that. But it is important to know those guidelines to sort of reduce those health risks. First and foremost, always wash your hands after handling the birds, their equipment, anything dirty, and you have to supervise your kids if they're out there trying to help you, right? I think kids love getting involved with farm animals, and it's great, but they have to wash their hands, and you have to make sure that hand hygiene is number one on the list of things to do. Additionally, make sure the animals, supplies, and anything dirty stays outdoors. We don't like hearing that people are bringing the chickens in to snuggle on the bed and mix it up with the other animals in the house, which I'm sure never happens out in the country. But you don't want to mix those things together because there unfortunately can be some bacteria on the animals themselves. And then handle all the equipment and make sure that you have the appropriate cleaning processes for all of the equipment. So are you carrying disinfectants? Are you only using cleanable equipment? Those are some of the things that you need to make sure that you're ahead of when you start using these backyard chicken coops and flocks.
I'm still trying to get the picture of snuggling with the chicken, but I'm gonna pass to the next topic as we move on. Dr. Coward, I'm gonna point to the next topic, which is one that is an issue for me personally as a neurologist, is that instant test results are now the norm, but that's not always a good thing. A new CBS report examined how the 21st Century Cures Act, which mandated immediate access to electronic health data, is changing how patients receive lab and imaging results. Now, while transparency is important, some patients now get to see the results, including cancer markers or serious diagnoses, before their doctor has a chance to see them themselves and explain them. For some, that's empowering. For others, it's traumatic. I know exactly what this story is all about. Dr. Cowart, talk us through the pros and cons of this just fact of life now.
Yeah, it's you may not think it would be relevant to somebody who practices in a hospital, but I have many patients who watch their portal or their account online for their results, and sometimes know them before I do, and
Wow.
so it can really impact us. And speaking of current news, so an author who I have read her books for many years, her name is Jenny Lawson.
Okay.
She goes by the blog S. So she made a post the other day on social media that said she'd been diagnosed with a cancer, with a neuroendocrine tumor. And then she commented that she realized she had cancer after she read the results of her endoscopy. And she texted her doctor and said, "Someone sent me my endoscopy results and I think I have cancer."
Oh my
And
goodness.
she said she described it as overall positive experience because he called her right away and then was able to walk her
Wow.
through the diagnosis. But it can be even very serious test results are coming to patients before we can get to them first. So I think knowing that this is the fact of life, when I'm talking to my residents and my trainees, I couch it to them like this. I say, look, this is meant for safety. This is meant to be sure that nothing gets overlooked, that patients have access to their records. When we are patients ourselves, we want our information as fast as possible. So knowing that that's what patients need, it's what they deserve, it's what they want, then we need to work on our processes when we are awaiting those serious test results, when we are waiting for biopsy results or something that's going to be life-altering, that we make sure that we have time carved out to go talk to that patient. So even if they do see it quickly on their portal, we are headed their way, or we are calling them, or we are making a plan to come and give them their results in the timely fashion that they want. So making sure that we are changing our priorities and pathways
Right.
to make sure that we are able to talk to our patients when we get that information. And then second is if a patient does get information
Right.
ahead of when we would be able to have that conversation with them, and they call and they have questions because they looked it up online, or they Chat GPT said this,
Yep.
that we have that conversation sensitively, that we're not defensive about it, that we know that they have access to their data and they should have access to their data. And so we are not threatened by that. We are part of that team as well. And we expect our patients to look things up. And so if they do have information ahead of when they're talking to us, that we just acknowledge that. We can help tee it up for them ahead of time. So if we're waiting for that biopsy result, we can tell them, we think it's going to come back tomorrow afternoon. I'd like to try to come by and talk to you right after it comes by. Or if I get the information first, I'll give you a call. And just make sure that we have a plan so they're not sitting there anxiously waiting for us to talk to them without us being aware that we need to be part of that.
I love you've summarized it beautifully. I'm going to move to yet another topic that also made headlines, and this is in the celebrity world. And this was two very well-known singers, Michael Bolton and Billy Joel. They had spotlights on two brain conditions, two very different ones. So two legendary performers made health headlines with singer Michael Bolton announcing he's been diagnosed with glioblastoma, an aggressive and often deadly form of brain cancer for which he underwent surgery late last year. Now he's recovering, and he says he actually plans to return to touring, bringing renewed awareness to a disease that remains one of the most difficult to treat. Meanwhile, Billy Joel canceled part of his tour following a diagnosis of normal pressure hydrocephalus, short NPH, a condition often mistaken for Alzheimer's or Parkinson's disease. Unlike many neurologic diseases, NPH can sometimes be treated with a shunt procedure, offering hope for improved symptoms in those afflicted. Dr. Draz, I'm going to point this at you. I want you to unpack the first diagnosis. That's Michael Bolton. What is glioblastoma, and why is it so hard to treat?
Yeah, thank you, Joe. Glioblastoma is kind of the scourge of the brain tumor world. It is, like you mentioned, one of the most aggressive, and it's a fast-growing tumor often that takes people's lives within a matter of months, not years. Unfortunately, it's a very invasive tumor.
Right.
It gets into the tissue, and there's only so much you can do for it once it invades the local tissues, other than where it's originally located. So there are remnants of these tumors that go all over the place, and they just, unfortunately, once they invade these areas, it's hard to deal with the tumor cells without injuring yourself from the normal tissue itself.
Let's go to Billy Joel's diagnosis. Normal pressure hydrocephalus is often misdiagnosed.
Mhm.
How can a patient, or even doctors for that matter, tell it apart from other conditions that it represents? Maybe you can just walk us through
Yeah.
what are we talking about here?
So for those of you that don't know, the brain and spinal cord are bathed in spinal fluid. It's made in the brain, and the term hydrocephalus comes about when you have too much of that spinal fluid in place. And by having the extra fluid, it puts pressure on the different areas of the brain and that surround the ventricles. The ventricles are where the spinal fluid is made and also is reserved, if you will. By putting pressure on the areas, you come up with a form of symptoms like you had mentioned. They call it the 3 W's. Wobbly, wet, wacky is what we were taught in residency. So you become gait unsteady, so it can be confused for a Parkinsonian-like picture. So when they say Parkinsonism, it can look like that.
Okay.
You become incontinent, wet. You become incontinent of urine typically, because that's where the nerve fibers go around the ventricles. And if you put pressure on them, you lose some continence of your urine typically. And then wacky, or really what they're trying to describe is memory dysfunction. So that's where the dementia aspect of it comes in. And that triad, if you will, is diagnosed with a combination of, you look at imaging, and there's certain characteristics on MRIs that are noted, and it's also, you can do a spinal tap on this and take off fluid and see if that helps some of the symptoms be alleviated. There has to be a somewhat high index of suspicion, and as you mentioned, the shunt is typically or drainage of the excess fluid is typically where these things are treated, and that can be over time. These things come up on you relatively slowly. Sometimes it's not a super quick diagnosis,
Mhm.
because it builds up over time, and the same with the resolution if it gets treated. So Billy Joel, he and I are motorbikers, and he has to be very careful if he's going to be riding motorbikes with this, and it's one of those things where the balance is affected, that kind of thing. I grew up with Billy Joel. I watched him on stage many times over the years, been to several of his concerts as far back as organic chemistry as an undergraduate. And I will say that, like I said, it can creep up on you slowly, and we wish the best for Billy. I mean, if you ever get back to it, come back to Phoenix, we'll go riding. I got some good roads for you, buddy.
I love that. One last question here. This has put a spotlight, as usual, when celebrities publicly share very serious health diagnoses, which have become fairly common lately. I'm just wondering, a good thing? Does it help these conditions in terms of getting support? What's your take on that part of this?
Yeah, I think, I treat a lot of epilepsy, and we do a lot of neurologic conditions. You think of Michael Fox for Parkinson's, or Muhammad Ali for Parkinson's, and you think of John McCain or Ted Kennedy or Beau Biden with the brain tumors. I think it lends credibility, not credibility, but it lends awareness, and people will go get checked up based on what they hear. I had symptoms like that. Let's go get checked out. So I do think it is helpful for people to relate these conditions to what they may have, and that awareness component, and see how people deal with it can be very, very helpful for patients and their families.
Up next, our experts answer your questions, and we'll be right back.
Did I get a letter? Did I get a postcard? Woo, Mr. Postman.
Hey, it's Dr. Joe Sirven. I have a new show called This Week in Health, and it's part of WJCT News Now. Local news you can listen to anytime, anywhere. When you sign up, you'll unlock 4 local podcasts delivered straight to your podcast app. I break down the week's biggest health headlines and what they mean for you. Start a free 30-day trial at wjct.org/newsnow. And if you like it, become a monthly donor to support WJCT Public Media.
Just another bill to pay. Just another bill today. Woo, Mr. Postman.
Welcome back. I'm Dr. Joe Sirven, and this is What's Health Got to Do with It. Our producer, Stacey Bennett, joins us now with questions for our experts from our listeners. Stacey, how are you?
I'm good. How are you?
I am doing good. What do you have for us today?
Well, this first question comes from Rico in Albuquerque, New Mexico. He says, and this is a serious question, if laughter is truly the best medicine, is humor good for your health or just a great excuse to avoid cardio?
Hey, Dr. Coward, I'm going to point this one at you. Help Rico out with his philosophical question here.
I think Rico and I could be friends.
Yes.
So I think they're two separate things. Unfortunately, we probably still need to be doing some cardio, but laughter is apparently really good for you. It doesn't just feel good. We talked on the show a while back about vagal stimulation and vagal maneuvers.
Yeah.
And how these could be good for you. It can help regulate stress. It can lower your heart rate, lower your blood pressure. So as it turns out, humor and laughter, because of the movements of the head and neck, they can cause some of this vagal stimulation. It can be a vagal maneuver. So laughter could actually be quite good for you. I wouldn't use it as an excuse to skip leg day, but it can be a really good thing. It can help lower your stress level. It helps you feel better. Because laughter is also contagious, this can be a positive thing. This helps us avoid Dr. Nielsen's team and spread positivity rather than salmonella.
There you go. I like that connection there.
No vaccines for laughter.
Right.
Yeah.
All right, Stacey, what else do we have here?
This comes from Andre. He's out of Orlando, and he says, I've seen a lot of athletes collapse from heart issues or concussions during games lately, and it's kind of scary. Is there more happening, or are we just seeing it more on TV? And could supplements or other stuff be part of the problem?
That's interesting, Dr. Truskowski. I agree with Andre. It does seem that maybe I'm watching the same games or something, but it does seem to pop up, or seemingly pop up more frequently.
Well, I think it goes back to the awareness. Back when I was playing football, or back in the 70s and 80s and 90s for that matter, these things didn't pop up that much. They weren't well publicized, but I think it was there. You know what I'm saying? It's just what really got the headlines were the cardiac stuff. I mean, just a note: I'm not a cardiologist, but any heart condition is a very serious condition. If somebody's passing out from a heart condition during a game or otherwise, that has serious consequences. So that needs to be checked out. So for our listeners, if you have friends or kids or classmates or teammates, those need to be checked out. So that's all I'm going to say about that. But let's go to the concussions. I mean, CTE is a big thing in neurology, and there's been movies made about it. And 10 years ago, people were not really that aware of it. Now they are. If you see the tents on the sidelines and the independent evaluator on the side of the NFL, on the sidelines of the NFL, this is a good thing. Becoming aware of it. I think allows the public to understand it. But it also has, like I said, I think they've been there for a while. Dr. Amala, who brought this to one of the pathologists who brought this CTE business out of the NFL to fruition and to our awareness,
Right.
allows us to say, how do we deal with it? And we've updated things tremendously on how we treat concussion based on that. So the awareness and the pathology and evaluation process has been a very good thing. There's guidelines for it now when there never used to be. So I do think we're seeing a little bit more on TV, and I think that's a good thing actually. So we can we can make those decisions on where we let our children play, and then follow guidelines that have come about since this has become more popular. They've designed new helmets, they've designed different protection, time away from the sport. Now, with regard to the supplements, there are some potentially supplements that could potentially interrupt heart, in particular heart rhythm problems,
Sure.
and that's a long laundry list of things. So if you're planning on using supplements, my advice to you is always talk to physician, maybe the pharmacist, and even look up things on we call it Dr. Google-itis at this point in time, but just learn of the risks. The caffeine containing compounds, like Red Bull and all that. I'm not saying that's a cause of it all, but they can affect the blood pressure and heart rate. And if you make the wrong combination of somebody who has a pre-existing heart condition, you might be a setup for that. So learn what to do about learn what you're taking when you put it into your body, and see if there are any potential side effects. So knowledge is power in this regard.
Stacy, what else?
Segueing on TV, Olivia from San Diego, she's been binging The Last of Us, which posits a zombie apocalypse from a fungal pandemic. She says, putting aside zombies, how realistic is a fungal pandemic?
Chad, I do love this show. I will say it out there. As dark as it does bother me a lot.
Yeah.
Talk to us about, perhaps not the zombie part, but I mean, what about a fungal pandemic?
Yeah, and what a great show it is. So it's a great question. We talked about this in a prior episode or two. But while The Last of Us is fictional, the idea of a fungal outbreak isn't totally far-fetched. I don't think, though, it would cause a zombie apocalypse, sort of how they show the cordyceps fungi in this case. Fungal infections don't really spread between people quite like viruses do. So a true fungal pandemic would probably look more like an isolated, hard-to-control outbreak, probably in a healthcare facility. These outbreaks, in fact, already occur, actually, and they are truly a nightmare for people like me and other hospital epidemiologists and clinicians to deal with. So, for example, Candida auris, which is a yeast fungi, it can survive on surfaces and resist cleaning in healthcare facilities, and it's extremely difficult to get it out of your facility once you get it in there, with the bacteria or the fungi spreading all over the walls and the ceilings of the hospital rooms and anything it touches. So in a real outbreak, I think it could be a real issue, and certainly other organizations have gone through that, but I don't think we'll be seeing, cordyceps zombies anytime soon.
Thank goodness for that part right there.
Yeah, for sure.
Stacy, what else?
Oof. Maya from Phoenix, Arizona asks, I've noticed a lot more people my age ditching vapes and going back to cigarettes. Is that just me, or is something shifting here? Could vape restrictions be pushing folks back to smoking?
Dr. Coward, this is kind of another like an interesting policy question. I don't know myself or where this is going, but could you kind of help us out? And what are your thoughts?
Yeah, it's a great question. I had to look into this. So the good news is that nationwide, we haven't seen that as a national trend in terms of rising cigarette smoking. But I have a few caveats to that. So first, the data that I'm looking at here is on the American Lung Society's website, and it comes from CDC website data. And their most recent data is from 2021, so it is a few years past. But that showed that overall U.S. smoking trends in adults, all adults, had continued to go down over time. And in youth in particular, it was continuing to drop. This is for cigarette smoking. So the good news is fewer people are picking up cigarettes. The bad news is that I just can't tell you if that trend holds true now 4 years later from when this was collected. I will say that vaping was initially touted as a means of getting people off of cigarettes. It's still a nicotine delivering product, but it doesn't have some of the same risk factors of cigarette smoking, ideally, or at least advertised to be cleaner than the smoke from a cigarette. I don't know if that's, how true that is, but that's how it was advertised. So they really advertised these products initially as helping people get off of cigarettes.
Mm-hmm.
The issue with that is that vapes have a lot of nicotine in them, so they are highly addictive. People may be using a lot of vape product and become highly addicted to the nicotine within. And then if they're looking for something to replace that addiction with, it is totally possible that they could switch to cigarettes or other addictive stimulants and substances. So I haven't seen anything in the data currently to support that there's a rise in cigarette smoking, but I do think it is possible. What the listener is asking, because vapes contain nicotine, cigarettes contain nicotine. People who are addicted to nicotine will look for the products that get them that nicotine. So to our earlier discussion about cancers, I think staying away from any nicotine delivery substance, whether it be cigarettes, pipes, vapes, cigarillos, whatever it is going to be better for your health in the long run. Vapes are highly addictive, and they are marketed in flavor packs that are really palatable for the younger folks. And that's a good way of getting somebody addicted to nicotine products who might then want to switch to cigarettes if vapes are harder to find. So not sure I've seen evidence of this happening yet, but it is possible. And so the more we can help folks avoid these products at all, the less likely they are to end up smoking cigarettes.
Got it. Stacy, what else we have?
This comes from Marco, who is in St. Pete, Florida. He says, I really loved that episode on empathy in medicine where Dr. Sirven interviewed the actor. One of the guests on the show said nurses were better communicators than doctors. Do you think being a kind and understanding doctor is just as important as being a smart one?
Dr. Draz, this refers to when we interviewed Mr. Jim Pittick from Best of Show and many other comedy roles, and he was talking to us about his experiences. So number one, shout out. Thank you, Marco, for listening. Number two, what do you think? I think this is a great question, and you're an educator. What do you think?
Well, it's a fascinating question, and people have discussed this kind of ad nauseum over time. And I say, what's wrong with being both? I think that the truly the best professionals, no matter if they're nursing or doctors, are excellent communicators. I was once told in medical school that to become a good doctor, you have to be really a good communicator. So this is a well-known thing. The business of understanding what your doctor tells you is important, and if you can relate to your physician on a one-to-one basis, I think that is super helpful. Nurses have that skill. Some nurses don't. Some doctors don't. And I think we suffer when that happens. So to answer the question, basically, I think you should do both. I think we have the capacity to do both and take the time to do both. And when that happens, that's the magic of medicine. That's the art of medicine. You combine your human qualities along with your medical knowledge, and putting those two things together makes you a much better doctor, and the patients know that. When we do quality surveys, our surveys when people are in the hospital and they get these follow-ups, they say the doctor listened to me, the doctor understood what I was trying to tell them, and when that comes, like I said, when that comes together, that's the magic of medicine.
We have time for one more question. Stacy, what is it?
This comes from Elias out of Mesa, Arizona. He says, from unrefrigerated deviled eggs to undercooked burgers, Memorial Day cookouts and picnics seem to have a lot of food safety issues, what's the grossest outbreak story you've ever dealt with?
Chad, I'm not sure if I'm ready to hear
Ooh,
your answer.
I don't know.
But please remember we are on public radio. So
Yes. So we want to keep funding, and I want to keep my job.
there
right?
you go.
So,
There you hit it.
there's a lot of places I could go, but I think tying in some other topics we've talked about at the beginning of my career, I think what was probably the grossest outbreak I was involved with was there was a conference being held, and someone showed up sick to that conference with norovirus. Right, we've talked
Aye.
about that. And this person couldn't quite make it to the restroom before they vomited, and they did so on the floor in front of the restrooms, and it was carpet. So the staff cleaned it up, but unfortunately, norovirus is very difficult to clean and kill, and so the outbreak occurred when many people walked right over that spot on the carpet and kicked it up and became sick with norovirus less than 72 hours later. So it just underlines the fact that certain things are really tough to kill, and that conference center ended up having to rip up that carpet and going down to the concrete to get rid of norovirus. So, please monitor your symptoms, and for the love of everything, don't go anywhere if you have a GI or a gastrointestinal illness because you put everyone else at risk.
Okay, I'm going to let that be our final word there. I want to thank our incredible three experts, Dr. Jennifer Cowart. Jennifer, always good to have you on our show.
Thank you so much, Joe. It's so good to talk to you.
It's so good to talk to you. Dr. Joseph Drazkowski, he is in Mayo Clinic in Phoenix, Arizona. Dr. Drazkowski, always great to have you.
Always great to be here, my friend.
And Chad Nielsen from Nemours. We're always delighted to hear your thoughts. Good to have you here.
Yeah. Thanks, Joe. I appreciate it.
You bet. Well, that's our program for today. We hope you've enjoyed our show. If you missed anything, you can listen to the full episode at WJCT.org and on your favorite podcast app. Thanks to all of our guests. Our executive producer is David Luckin. Stacy Bennett is our producer. Brady Corum is our director. Caden Collins and Caroline Kahn are our researchers. If you have any questions about this or any topic, let us know by calling us at 904-358-6362. Email us at health@wjct.org or tag us on X, Threads, Blue Sky, Facebook, LinkedIn, or any social media at Sirven. I'm Dr. Joe Sirven, and you're listening to What's Health Got to Do with It on WJCT News 89.9 Jacksonville. Thank you for listening, and stay in touch.
Support for What's Health Got to Do with It is provided in part by the American Brain Foundation invests in research across the spectrum of the brain, knowing all brain diseases, disorders, and injuries are connected. There can be no cures without research. Learn how you can make a difference today at AmericanBrainFoundation.org. Rethreaded needs you to make a difference in the lives of human trafficking survivors. Learn more about supportive services and an array of survivor-made products at rethreaded.com. And by Neurelis, a leading neuroscience company focused on the development and commercialization of therapeutics for the treatment of epilepsy and other neurologic disorders. The company's unique drug portfolios strive to address unmet needs in patient care. Learn more at Neurelis.com.